Hello, this is Dr. Drew Hall with Hall Upper Cervical Chiropractic of Los Angeles. Today what I want to talk about is how to determine whether you have what's called straight neck syndrome or military neck or loss of cervical lordosis. For those of you who don't know what military neck or hyperlordosis is, that the cervical spine, if you look at the cervical spine from the side, it should have a C shape like this. And of course the head sits on top of the neck this way. Now lots of people, when they have a car accident, a sports injury, a slip and fall, and the upper neck vertebra, the top of the neck called the atlas, that's this guy right here, when that vertebra shifts out of position and locks, it irritates the postural center and it causes the neck to go straight. Now really the only way to verify this is through what we call lateral X-ray film. So a picture is taken from the side of the neck in the neutral posture, the person's normal posture. Of course, we don't want to change the head position when we take that picture because it would change the neck curve. So either the person's standing, they're sitting, they're in a chair, they are in their normal head posture, take a lateral cervical X-ray. You can tell whether the neck is straight, whether it's a normal curve, whether it's too much curve, and in some cases, people's neck is in what we call a reversal or a hyperkyphosis. Now, the reason that people have straight neck syndrome is, like I said, is a result from injury to the upper neck. The top vertebra in the neck weighs 2 ounces. Again, that's this guy. And that joint bear the weight of a bowling ball, your head, 10 to 12 pounds. So the head rests on the atlas. When you have an acceleration or deceleration injury or a blunt head type trauma, the top vertebra can shift and damage the soft tissue and become locked. It irritates the brainstem, which is part of the spinal cord that lies inside of the atlas, and that area is responsible for postural muscle tone control. And basically what happens is when you have an injury to the neck, the scalene muscles, which are these side muscles on the neck that anchor into the clavicle and the first rib, those muscles go into spasm, and what that does is it takes that neck that's like this and it straightens it. Now this is important for several reasons. One, when you develop embryologically, your spinal cord is meant to fit in a C-shaped curve in the neck, and when the neck becomes straight, effectively what's happening, if you have one end of a rope and I have the other and we're pulling on it, that's basically what's happening to the spinal cord. And this can have a number of consequences symptomatically in the body. A, neck pain because the muscles get tight, but from a neurology perspective, when you have tensile stress on the spinal cord, because the brainstem sits in the upper neck, that can cause irritation to the cord and cause a whole host of symptoms. Now, from a musculoskeletal standpoint, because the muscles in the lower neck become tight and it can entrap the nerves that supply the arms, you can have numbness and tingling, thoracic outlet syndrome, upper back or thoracic pain, pain between the shoulder blades. And the reason you get a lot of the upper back tightness is when you lose the curve, the normal curve in the neck, you get what we call anterior head bearing. And when your head is in its neutral upright position and you've got that normal curve, the head is balanced over the rest of the spine and the shoulders the way it should be. When you lose the curve and the head starts to move forward, because you have a 10 to 12 pound mass, your head, every 3/8 of an inch it moves forward, it doubles the weight effectively on the upper thoracic spine. And basically what does the body do? It contracts the upper back and the mid-thoracic area to keep your head upright against gravity. So also from a neurology standpoint, when there's tensile stress on the cord, you can have TMJ and ear pain because the muscles in the upper neck also tighten. Cognitive problems are very common with straight neck syndrome. And as I already said, thoracic outlet, numbness, tingling in the arms, and low back pain because now the head's being covered or carried forward. There's a whole adaptation that takes place through the whole spine to try and accommodate that new posture. So if you're in the Los Angeles area, if you come across this video, you're interested in upper cervical care, basically what we do in the office is we are experts at determining how this top vertebra has shifted under the skull out of position. We do that through advanced imaging by looking at the joints between the head and the neck to determine how you're off, how your joints are built. And then we deliver a very precise, non-invasive correction. There's no twisting, there's no popping, there's no pulling of the spine. And the goal is to get that segment back in position, get the soft tissue to heal up, and get the nervous system to function the way that was intended to. And a normal consequence of that over time is that the inbound structure will start to come back to how it should be, and symptomatically, as the nervous system starts to heal, mend, and repair, the body works better, and most of the time, most of these symptom problems will fall by the wayside. So we do offer a free consultation in our office. If you're in the LA basin, we have an office in Los Angeles. We also have another office in Carson. We do offer a free consultation. Our Carson office number is 310-324-6172, and our Los Angeles office is 213-399-7772. So I hope this video was informative, and we look forward to seeing some of you hopefully soon.